All right, well, good evening or afternoon or morning or whatever time it is. This is sort of a practice run on some lecture material that I'm posting for all of you on social science and COVID-19, just a few slides for my students that I threw together. So start off by saying the worst is yet to come for reasons that we'll see, that you can sort of see already in this chart right now. So, I'm not going to get into the technical stuff, too technical. The main thing, I want to explain is how we can sort of understand this and explain it to other people. So that they can spread the word and we can have a better chance at taking on this thing more effectively and more scientifically. So I thought I would list off some people here. If you're interested, I strongly suggest following them on Twitter or other social media sources, or following their organizations and other. Can't touch my face, but looking and trying to understand or looking at what they're doing and seeing what they have to say. I think these are some of the best systems thinkers, or at least the best that I know of, and there's of course many more. Okay, so I think this is a good way to start. So we know that people have been stocking up on TP. So yes, everybody runs to the store and, all the TP's gone and, everybody runs and panics and goes to the next one and so on. Now imagine the same thing happening at the hospital instead. But instead of TP, people are trying to get intensive care units, ICU beds, and ventilators that are running out. And, we are actually running out. So that's why things are canceled. So it's this is a major crisis. Not since the Second World War has the West, in particular, faced something so challenging and sort of an existential level. And when I say existential, I don't mean in terms of truly existential, that COVID-19 is going to kill kill humanity or something like that, or even destroy Western civilization, but it's definitely going to change it, and make the West is going to make some modifications. I'll talk more perhaps in a future lecture on the differences between the way the US and European countries have handled this in contrast to what we've seen in East Asia. And that ties into a lot of the other material. Okay, so one of the key things that I've noticed that people don't understand about COVID-19 and how it's spreading is they don't understand exponential growth. So there's a legend told in math classes around the world that this king offered a reward to the inventor of chess. Everybody loved chess, but the king was kind of a stingy bastard, and he said, I'm not going to give you any money or any gold. I'm just going to give you 1 grain of wheat on the first square of the chessboard, 2 on the second, 4 on the third, basically doubling each one for all 64 squares on the board, and you'll get a lot of grain, and then we'll play your game and you can leave me alone and I'll just hang out with all my money and so on. Well, the thing is, once you start doubling, and that's what's going on here, you're doubling each square on the chessboard, adding double the amount of wheat to the next one. The thing is, once you start doing that, it really starts adding up very quickly. So as you can see here, go down here. So you start off with 1, and then you go to 2, 4, you're doubling that to 8, and so on, all the way to 128 by the end of the first row, double that to 256 on the second, By the end of the second row, you're at 32,000, almost 33,000. Double that to the, roughly 64,000. By the end of the third line, you're already at 8 million. You double that to 16 million, and then, you're doubling again and again, and so on and so forth. The final number, when you get down here, is 18 quintillion, 446 quadrillion, etc., etc. What you see up there. Enormous number, and obviously the king went bankrupt and was deposed and beheaded by his subjects. Okay, so what does that have to do with coronavirus? Well, as you can see here, if you have sort of just kind of linear growth, what we call arithmetic growth, that's basically growing by additive principles. So as you can see here, what you have here is what we call a geometric or an exponential growth curve, and you should probably get in the habit of calling it exponential growth. So as you can see in this chart, throughout most of the, say this is time down here or something, throughout most of the timeline, this arithmetic growth curve is going up much quicker. It seems like a larger amount and so on. This exponential one doubles. So, it starts out small and still small and, doubling, and then all of a sudden they get bigger. And pretty soon, the exponential growth curve is way above the other arithmetic growth curve. Now, this is important to understand coronavirus and why we're going to see millions, probably millions of people infected with coronavirus, COVID-19, in the United States, probably in by May, sometime in May. So this is a COVID-19 lag tracker. It's tracking how many days behind other countries are behind Italy. So Italy here, you've got the dotted line, and here you've got cases confirmed per 10,000 inhabitants. Won't get into the technical stuff, just pay attention to the lines and the general trajectory and stuff. Okay, I think perhaps more importantly down here, you've got the days behind Italy. So these are different countries where they're sort of at in terms of looking at cases and so on. So the United States, and when this was done, was about 20 days behind Italy. But as you can see here, it's getting to 16 again, or we're seeing it rise exponentially. That is looking at it in sort of a different way. But again, what you see here is the black line for the United States is basically following Italy. I mean, Italy is that gray line there. I mean, we're basically almost it looks like we were just drawing right over it, following them. And you look at Iran. Iran's got the worst situation right now, as you can see quite clearly there. Spain, though, is rising even more rapidly than Italy, so that's pretty alarming there. So how is this happening? So these are what we call social networks. There's a lot here. I'm not going to get into what social networks are, but basically what you see, those nodes there, this is tracking a flu. I believe the H1N1 flu from 2009, and those little dots there are people, and the people, I can't remember exactly what the coloring is here. The dark red ones are people who have contracted the flu, and I think the yellow ones are people who maybe I can't remember, have been tested or something like this, or maybe have recently caught it. I think maybe that's what it was. But okay, the important thing here is that you see those lines there are the connections that they have. These are mathematically worked out connections to other people. These could be friends or family and so on. So you see through this whole social network, as time goes by, it spreads through the network. People who are connected to other people, who engage, are closer to other people. So this would not be necessarily a virtual network. This is more of an actual physical network. People that maybe they have a lot of friends, so they see a lot of people. They have parties or excuse me, things like that. So you see them sort of more or less, basically, that's kind of, it spreads out. This flu spreads out there. So if you look at the corner one, the three down at the bottom, you can see the dark red lines really spreading out through the social networks. So what we have right now, if you think exponential growth and you think social networks, we have COVID-19 is spreading through these social networks at an exponential rate, and that's quite alarming. This is the chart from the study that made the British and American governments essentially change their tune. Great Britain had a truly bonkers idea that they were going to try something called herd immunity to try and manage the disease, manage infection rates, monitor people, and try and get everyone immune to it. Number of problems with that they're worth saying. First of all, no, the UK does not have the capacity. The government there does not have the capacity to do that. The only country in the world I can, imagine being able to do something like that would be China, and China certainly never tried anything like that, or probably really even considered it. So the UK. The Boris Johnson government backtracked on that just in the last 48 hours or so. The Trump administration, Trump and his government, especially him, basically saying this isn't a big deal, you can go on to work, you're going to be fine, and so on and so forth. This is from the scientific study that comes out of Imperial College that basically made the British government change their tune once, people in America, high-level officials started to understand what this actually means. They started freaking out too. So this is basically coronavirus deaths if no action is taken. So in Great Britain, you're likely to see 500,000 deaths. In the U.S., you're likely to see 2.2. Look at this jump. Basically, you're not trying to. If you're not trying to stop the disease at all, it really starts taking off in mid-April. You see it growing exponentially and just taking off throughout May, peaking sometime in June. Potentially, we don't know exactly for sure, but by that time we'll be having roughly 50,000 people die per day. With it leveling off again in the fall, and probably if there's no vaccine or treatment that's been developed, it'll probably pick back up again during the flu season. So this is a serious illness. So flattening the curve. What does this mean? Why is it important? So basically flattening the curve. If you think back here, this is what happens if you don't do anything. Not only is it terrifying in terms of the number of deaths that you see, but it's also terrifying if you look at that line, dotted line there. That's the healthcare system capacity. So once it goes up above that, then the healthcare system can't handle it. Not just the COVID-19. This is really important to understand, but there are other hospitals will be overwhelmed with COVID-19, but also just other cases, regular overcapacity that we're already suffering with. So this could get really bad, especially as healthcare workers themselves almost inevitably get infected more often. So do we have examples of this working in the past? Yes, we do. Here in Pennsylvania, so this will hit home for some of you. So this is comparing Philadelphia and St. Louis and the effects of social distancing in the 1918 flu. As you can see, Philadelphia, you had basically that huge spike. There was no attempt to really stop anything. You get the first case in on September 17th. They tried social distancing in October 3rd, but didn't really do a good job, and cases, deaths just, really skyrocketed through the months of October and so on. St. Louis, they caught it a bit later, so it, spread there, got there later, but they kind of, were able to learn from Philadelphia, kind of like we should be learning from Italy and China and so on. And as you can see, they enacted social distancing measures right away, and they were able to flatten the curve, as we say. Now, again, if you see cases jump again during the flu season back in November, so we have to keep that in mind. But it's clear it worked better and was much less disruptive to St. Louis than Philadelphia. So what's the big deal? What's so bad about it? Where should I put myself? I'll go over here. Yeah, so as you can see here, it's clearly much worse, 4 to 7 times higher than the flu in terms of for people 60 and older. In terms of fatality rates, we're looking at basically 12 to 24 times higher than the flu. So this is, it's a serious problem. How contagious is it? This chart looks at COVID-19. As you can see, it's more contagious than the seasonal flu. And again, that's really important to understand. It's a little bit more, roughly more contagious than norovirus and so on. And you can see, much less of the measles. You can see how the measles wiped a lot of people out. Again, COVID-19 this could be something that comes up again. COVID-19 could be a prelude of things to come, of some of the other, some new thing that we've never experienced before, that maybe it has an infectious rate that's like measles, but is has the symptoms of COVID-19. That would be devastating. It's why we need science and pandemic research, which I think we'll be getting soon. A big problem in the U.S. is lack of testing. This chart shows a comparison of tests per million people, and you can see, the United States is way below other countries that have much smaller populations. Looking at South Korea, where they're, they're testing about 3,600 people per million people. We're doing about 23 people per million people, and we have 329 million people. So that's a big scandal, big scandal that will go down in history as a huge historic disaster. And there's a disproportionality in terms of who's getting tested, where they are, and so on. You're seeing obviously places where there's more people getting tested more often, but less testing happening in some places, so we don't know necessarily, where it is, the extent of it yet. But they're growing each day, where, as we're doing more testing, we're going to see more cases, both because we are testing more, but also because, again, going back to the first few slides, it's growing exponentially. So it's just hitting the elderly and so on. Well, just focus on the elderly for the moment. We'll talk about the disabled and, people who have other health problems later. Well, the labor force itself is changing. Older people are not, some small percentage of the population that's off, retired, isolated in their homes, or just in retirement homes. You've got, roughly around 20% of the workforce that's 60 or older. No, that slide's not right. Whoops. I've got to change that. Roughly 20% of people older than 60 or 65 are in the workforce. Okay, gotta change that one. So anyway, but a huge percentage, projected just in a few years, about 25%, one quarter of the of elderly people will be part of the workforce. So these are people who are often are often being also cared for by their kids who right now are in, what we call Generation X or millennials and older. You've still got a lot of baby boomers who are caring for their elderly, for their elderly parents. So, this is going to be a big challenge for our society on many levels. So I'd encourage you to, look at the course links, and we'll muddle through and, talk more about this and developments as they come. All right, Dr. Nielsen signing off.